Welcome to my channel. If you found this video, sex might be hurting for you or your sexual partner. First of all, I just want to say I'm sorry. Sex shouldn't hurt. It should feel good. And I want to teach you about why it might hurt, but also what you can do about it. I'm a pelvic physiotherapist, so I have a degree in physiotherapy plus extensive training after my degree in pelvic health. And why pelvic health is relevant for sex is that your sex organs are in your pelvic region, and your pelvic floor muscles that are also in your pelvic region really impact your sexual health and your sexual function. So let's dive into it. First of all, to understand why I have expertise in the area, I'm going to show you your pelvic floor muscles. Your pelvic floor muscles are what I am an expert at as a pelvic physiotherapist. So I have a model of the pelvis here. This is my pelvic model. This is the pubic bone at the front. This is your lower back, sacrum, tailbone. So if you look at your pelvis from below, you have your two sit bones here, your pubic bone, tailbone, and your genitalia are here. So if you have a penis, your penis would be here, and your vagina, if you have a vagina, would be here, and then this is your anus. And all these muscles, all this red here is depicting your pelvic floor muscles. So these muscles are intimately involved in the function of this region. So with sexual activity, oftentimes you're engaging in sexual activity with one part of your body in your pelvic region. That's not always true, but often we're using the pelvic region as part of sexual activity. Our sexual organs are in this area, arousal is felt in this area, and if you're involved in any form of penetrative intercourse, you may be receiving penetration either vaginally or anally, or you might be inserting your penis internally into your sexual partner as part of sexual activity. Let's talk about what might be causing pain in this area. So I'm going to break it into two parts. If you have a vagina and if you have a penis. So I'm going to talk first about if you have a vagina, and you can skip ahead if you have a penis. I'll put the timestamp in the description of the video so you know where you can skip to. So if you have a vagina, there's a few different reasons why you might be experiencing pain with sex. The first one is if you are participating in vaginal penetrative intercourse, your vagina needs to be able to expand and allow for penetration to occur pain-free. If your vagina is not able to do that, a really common reason why would be that these pelvic floor muscles actually can't relax well enough to allow your vaginal opening to stretch and accommodate for penetration. The other thing is the muscles could be tight. You're still able to insert something, whether it be a finger, tampon, penis, sex toy, but it's painful. It might feel sharp, shooting, achy. And that could be because the muscles are tight and sore. Like if you've ever had sore shoulder or neck muscles, you can touch those sore spots and go, oh yeah, that feels like a knot in my muscle. Little small knots like that could be in your pelvic floor. So it's not an actual knot, like your muscle's not actually tied into a knot, but there can be little spots within your muscle that are extra tight and they're sore because they're holding tension. The muscles being tight could be causing a secondary symptom of your nerve that supplies the skin of your vagina and your clitoris. And if the nerve is irritated, that can change your sensation. So it might feel like you have less sensation in those tissues, so you're not necessarily feeling pain, but you're having a hard time feeling pleasure. Or on the flip side, you might have hypersensitization, which means that touch that should feel good feels painful instead. So the really cool thing about this is if this is what's going on with you, the treatment can be to really learn how to relax your pelvic floor muscles. And I'll get into treatment a little bit later. And if you have a vagina and part of your sexual activity is anal penetration and you're experiencing pain with that, of course that isn't your vagina. However, because of where your anus is in your body, it could absolutely still be pelvic floor muscle driven. So I'm just going to show you here. This is the anal opening. And if you're having intercourse through here, you're having intercourse in the rectum. And if this is painful, likely these muscles around the area are tight and sore, or there could be a component of your skin being a bit irritated, or the nerve that supplies that region could also be a little bit irritated. All of those could absolutely be impacted by your pelvic floor muscles. I do want to note here though that chatting with your family doctor about this as well can help you determine if there's any other medical reasons why you might be feeling pain. And it's really good to know that your pelvic floor muscles could be the main driver as to why you're feeling pain. And I'll explain to you what you can do about that in the next section. If you have a penis and you're experiencing pain with sex, I'm going to talk about the few different reasons why. So number one, if you have pain in your penis when you have an erection, ejaculate, or during penetration, that could be from your muscles in the area, your pelvic floor muscles, being too tight and actually causing hypersensitivity of the area. Sometimes you also might feel pain in your penis if there's any sort of connective tissue or skin tension, and sometimes that can happen just over time. Sometimes that can happen with an injury. So your pain could be more coming from your skin as well. If you have testicular pain, I think it's really important that you chat with your family doctor about it just to rule out any medical things that could be going on. However, a lot of folks don't know that testicular pain can actually also be because your pelvic floor muscles are too tight. And what that does is it actually causes compression of the area, and it can hypersensitize the nerve that supplies your testicles, making them feel painful instead of normal. And if you're participating in penetrative intercourse through your anus and rectum and you find that is painful, again, that could be because the muscles around your anus are too tight, and so they're not able to relax well enough to allow for penetration to occur. And if that's the case, it can feel sharp, shooting, achy. It can also contribute to potential skin irritation. The other factor is if you're dealing with constipation or irritable bowel, then that region could be a little bit more irritated because of that. And the interesting thing is your pelvic floor muscles could also be involved in your bowel health. So it's really important that the pelvic floor muscles are optimized. The other reason you might feel pain in this area is if your nerve that supplies the skin of the area is irritated in any way. And that nerve usually gets irritated if there is tension around the path that the nerve follows, and it follows along your pelvic floor muscles. So those muscles aren't as close specifically to the area here. They're more this way, but they can absolutely impact what you feel in your anus and how comfortable it feels or how painful it feels. Now that I've talked about the causes of pain and why you might be experiencing pain with sex, I want to talk about what you can do about it. I think this is the most important part. Okay, we know why. What can you do though? That's key. You want to be able to have intercourse and for it to be fun and pleasurable, not painful. So regardless of if you have a vagina or a penis, the number one thing I recommend you do is go see a pelvic physiotherapist. Pelvic physiotherapists like myself have expertise in assessing your pelvis and your pelvic floor muscles. Like I mentioned before, most of the time when you're experiencing pain with sexual activity, it's because your pelvic floor muscles are too tight. And a lot of times we hear, oh, do your Kegels, do your Kegels. That's a pelvic floor muscle contraction. And that's the only thing that you hear about. Oh, I should work on my strength. But actually, if you're experiencing pain, it's more likely that you need to learn how to relax those muscles better. That way, your muscles can create space if you are receiving penetration, but also they can create space for your nerve if you're feeling pain in your penis or testicles or anus. Overall, learning how to relax your pelvic floor is key. If you don't have the financial means to access a pelvic physiotherapist, I do create videos on this channel teaching you how to relax your pelvic floor and teaching you how to do it with yoga moves as well. I'll put one of my favorite pelvic floor yoga classes up here for you to follow if you want to try that out today. It's important for me to note here though that pelvic physiotherapists don't all treat all genders. So some advertise that they only treat male clients, some advertise they only treat female clients, and I think it's really important that you search for somebody who advertises that they treat you. So for instance, here at Karen Physiotherapy, we treat all genders. We aim to be as inclusive as possible. We have training in all anatomy, so we are really happy and open to treat anyone, and we want to create a safe space for you. When it comes to pelvic health and when it comes to these topics, they're incredibly personal and they are incredibly important because we're talking about intimacy in your life with the people that you care about most. It is so important that who you work with makes you feel comfortable and makes you feel like you can be yourself. The other thing that you can do that I think is really important is for you to see your family doctor or a doctor to talk to them about what you're experiencing. We want to make sure that you are also getting evaluated medically, and if there's anything going on there, that it's getting treated and assessed for you. You may have something medically going on, you may not. You might have, it might be all muscular driven, and we don't really know until we do an assessment one-on-one. The final thing that I want to talk about is what happens if you see a doctor and they say, no, everything's good, everything looks fine. Then you see a physiotherapist and they also say everything looks good, your muscles are working exactly how they should. Yet you're still experiencing some form of pain with sexual activity. There's one major factor here that often gets overlooked, and that is your psychological and nervous system component to your experience with sexual activity. And this is not to say, oh, your pain is in your head. That's actually not what it is. Your pain is real and you're feeling it and you're experiencing it. It can feel like this fully physical experience, even if when you're assessed in a clinical setting, it's not assessed to be a physical driver. What's really important to know here is that your body, your physical body, will respond to how your nervous system and how your mental state is doing. So, for example, if you do all your treatment and you're really good at relaxing your pelvic floor, and then something's happening, sexual activity is starting to happen, maybe some foreplay is happening, and you're starting to anticipate, okay, I might be having sex soon, sometime in the next few minutes. Your nervous system has a memory. So your nervous system might remember, oh, well, sex always hurts. And if your nervous system has that memory, what it can do is it can actually hyper react or hyper respond in that moment. And what's really interesting about our pelvic floor muscles is if our nervous system responds in anticipation of pain or fear or needing to flee or run, our pelvic floor muscles can actually contract in response. It's an involuntary contraction. The muscles tighten. And then when you go to have intercourse, the muscles are tight and it hurts. That cannot be replicated in a clinical setting. You cannot replicate sexual activity. So if you're lying there and no sexual activity is happening and somebody is examining you, or even if it's over a video call session and we're just talking about, can you relax your pelvic floor? Yep, I can. Okay, great. That's not the same for your nervous system as when you're actually trying to or starting to participate in sexual activity. It's actually more your nervous system response or the fact that you might have fear or anxiety, and that actually physically impacts how your body responds to the situation. Now, what's really amazing is that you can slowly start to actually retrain your nervous system. And this takes time. I've worked with people before where it took us a long time, took us over a year to really repattern the nervous system. And depending on who you are, it might be quicker, it might be longer, and depends a lot on your past and how long this might be going on for you. The really amazing thing about it though is it is treatable. Usually it takes a team approach, but it is treatable. Pelvic physiotherapists who have training in helping you down-regulate your nervous system and learning how to notice if your nervous system is hyper-responding, and then how you can actually tap into that to get your muscles to relax and for your body to feel like it's more calm and receptive to sexual activity. Some pelvic physiotherapists will have training in that. I have training in that, and we can actually help you with that nervous system component. But the other major piece is the psychological component as well. So having someone on your team who can help with your mental health and processing any emotions or any thought processes that you have around sexual activity, that is a really good person to also have on your team. And in an ideal situation, if you're comfortable with it, your mental health professional and your physiotherapist can communicate with each other. And that way we can actually help collaborate to give you the absolute best treatment plan and care for you. The psychological and nervous system component is huge. It impacts your physical body. It impacts how your body responds to sexual activity. It is not something that should be ignored, and it is something that can be treated with a collaborative and really open approach. To recap, you might be experiencing pain with sexual activity for various different reasons. I covered the reasons that physiotherapists can help you with, so tight pelvic floor muscles, irritated nerve, irritated skin, hyperreactive nervous system. The amazing thing is you can see a physiotherapist in a one-on-one setting who can assess where you're at and then treat you so you can have sex pain-free and enjoy it. If you feel like our clinic might be the right fit for you, we see all of our clients over video call, so you can book. I'll put a link in the description below. Book your first appointment with one of our physiotherapists, and we can help you start working towards your goal of pain-free sex. Let us know if you have any questions in the comments below. Give us a like if you learned something in this video, and subscribe to our channel if you want to learn more about all the different pelvic health topics I cover.